Hi, my name is Fatemi. I'm a medical director for the IVI GCC group, responsible for all the activities of the EV clinics in the Middle East. Once we have seen the couple with infertility problems, and I'm re-emphasizing the couple because it's not sufficient just to see the wife or the husband. Having children, it's a couple issue. So we need to see female and male partner together. So once we have done the anamnesis, we have to find out where is the problem. Now, the assessment, it also goes towards both partners. Obviously, the first thing is to evaluate the sperm count, the sperm morphology, and the sperm mobility, but also some tests in the blood endocrine profile of the male and female partner has to be done. The female has to undergo an ultrasound examination, and the most objective time of doing this ultrasound assessment is in the beginning of the cycle. We always recommend day 2, day 3, or day 4, beginning of the cycle. We can easily evaluate the shape of the uterus, to evaluate the tubes if there are kind of infections in the tubes, but most importantly, we have the feasibility to do what we call an antral follicle count. What does antral follicle count mean? This is an assessment of the ovarian reserve. And today we know that an assessment of ovarian reserve is extremely important. Knowing what is the ovarian reserve has a huge impact also for the treatment. We have also other methods today to evaluate the ovarian reserve. For example, a test which is available, we are working on it to generate a better validation of these tests. The name of the test is AMH, anti-Mullerian hormone. So once we have doubts that maybe there might be a problem with the ovarian reserve, we can also evaluate through an AMH testing what is the ovarian reserve. Now that will not reflect the quality of the oocytes, but it will have it gives us an idea about the ovarian reserve per se. Now once we have done the testing of the uterus, the ultrasound, the assessment of the ovaries, the endocrine profile, and also we have done the sperm analysis, most of the time we have an idea about the cause of infertility. But even if at this point it's not clear to us what is the problem, we have to go one step further and evaluate the permeability of the tubes. Now we used to have painful methods of evaluating the tubes. The name of the test is hysterosalpingogram. As maybe you have heard about that, we have to inject a contrast with high pressure into the uterine cavity. It has to go to the tubes, and once it goes to the tubes, if it's permeable, it will go through and we can take X-ray pictures. But it is a little bit painful, this examination. But today, with the 3D ultrasounds that we are having, we have the feasibility to do this test on a much less painful manner. So this is the next step to evaluate where is the problem. Now, having evaluated everything, normally in 90% of the cases, we know what is the cause and we can go further towards a possible treatment. However, we will have certain percentage of the patients where still we do not know what is the cause of infertility. And then we have to go one step further. Then we have to go towards testing of the chromosomes and of the genes to see if there is any kind of genetic problem which might be the cause of infertility. Today, our group has developed new methods of evaluation of undetected genetic disorders where you might be a carrier, but you do not have the symptoms, but coincidentally, it might be that your partner has the same carriership of these gene mutations. So through a test which is called CGT, we have the feasibility to detect also undetected carrierships of pathogenic gene disorders. So speaking about idiopathic infertility, the 10% that we always say, I think in the near future this idiopathic infertility will slowly disappear because our knowledge on the field of genetics is increasing very rapidly. So most of the time we will have a diagnosis and we will know what is the etiology, what is the cause of infertility. It doesn't make any sense to start a treatment without having a diagnosis. So first we need to have a diagnosis, and the next step should be going towards a possible treatment option.